a question to you. Should the birth control pill be available over the counter? There is a big debate on this issue. Dr. Angela DeRosa is up next to explain why she says this could be dangerous for women.
Well, it is 8:18, and it might surprise you to learn that September and October are typically when we see the highest number of births. And apparently, this is all the result of all that romance being felt during the holiday season. You do the math, right? We've got Dr. Angela DeRosa here with us this morning talking about birth control. And you're not only going to be dispelling some myths for us, but you're talking about some of the available options and the idea of making the pill available over the counter. There's been a lot of talk about this, and I'm sensing your fear. Let's just go to that first if we can.
I think this is a really, really bad idea. Unfortunately, the people that are making this recommendation are the College of OB-GYNs, and they're largely surgeons, and they like to deliver babies. And I'm saying this with a bit of grain of salt, is that most OB-GYNs don't understand the full breadth that oral birth control pills can provide for women, not only from a vagina. I mean, they mainly concentrate on vaginas, uterus, and ovaries. And I'm looking at it from a metabolic, internal medicine approach. It has consequences not only internally in the vagina, uterus, and ovaries, but also externally, meaning it can increase your lipids, it can increase your sugars, it can cause diabetes, cholesterol issues, and also heart attack and stroke, if not done properly.
Which is why you say it's important to get people in to see the doctor. And a lot of the research I was reading before this interview was about the importance of making sure these people get their annual checkup, because otherwise it might not happen.
If you're 21 years old, you're not going to go see the doctor. You think you're healthy and there's nothing wrong with you. So if you have the opportunity to avoid going to see the doctor yearly, which is another reason why it's such a great idea to not let this go over the counter, is because it's an opportunity I have to give some patient education to these young women who wouldn't otherwise do so.
All right, let's talk about some of the options out there that people might not know about.
Right, and commonly OB-GYNs like to prescribe a pill called low estrogen, and that's really good for patients who have a lot of bleeding problems or if they have cramping with their periods. But the problem is low estrogen, meaning it has low estrogen, has very high progesterone, and that can cause weight gain. It's the PMS hormone, in other words, so weight gain, crabbiness, tiredness. So it's great for bleeding and those types of heavy periods, but it's terrible from those other troubles. This one will also cause metabolic syndrome, which is increase in lipids, cholesterol, so overall sugars, and heart attack and stroke, if not properly balanced out. There are better options which have higher estrogen and lower progesterone, which balances most women out nicely. However, all oral birth control pills will increase your risk for heart attack and stroke because they kick out a protein when processed through the liver that increases your clotting risk.
You've brought in some other options if the pill is just not something someone can do.
So if you want to avoid the processing through the liver, which all oral pills do, you have others that go local. So one is called the NuvaRing, and it's essentially this. It's a ring that gets inserted into the vagina, and what it does is it delivers local hormone right into the reproductive tract, so you can actually have contraceptive effect, but avoid that liver processing, which increases your clotting risk and increase for heart attack and stroke. So this is a really nice option. There's also patches which operate very similarly and avoid the liver, which I don't have an example of, but that's another great option. Lastly, the IUD, which went out of phase many years ago because everyone thought there was an increased risk for infection and fertility, but that's a great option. It's a tiny little device that inserts right into the uterus.
Interesting.
And what that does is provide local hormone right to that area, which can create contraceptive and avoid the clotting risk.
All right, well, thanks for clearing some of this up for us.
You're welcome.
We appreciate it.
But don't go over the counter on this. This is a terrible idea.
Okay, thanks so much, and I've posted that on my Facebook page. Would love to hear some of your opinions about this. It'd be very interesting to keep that conversation going. We're gonna